Hello and Assalamu alaikum, ladies and gentlemen. Welcome to yet another episode of the Dental Talk. We have another very special guest with us here tonight, ladies and gentlemen. We have Dr. Carlos de Carvalho. He is an amazing dentist, ladies and gentlemen. If you've gone through his Instagram profile, you've seen it. We shared the Instagram profile. You've seen he's one of the pioneers of dental photography in the world. He started dental photography before it was normalized like it is today. And if you've seen his cases, they are absolutely stunning. He received his bachelor's degree from the University of Itona in Brazil in 2003. He received the master's degree from the same university and the doctorate from the University of Sao Paulo in Brazil. He went on to do his PhD in biomaterials from the University of Siena in Italy in 2008. He currently runs his private clinic in Salvador. He instructs at many continuing education courses, and one that I would love to specifically mention is the adhesive rehabilitations and tooth preparation course that he does all around the world with another world-renowned dentist, Dr. Miguel Ortiz. So he instructs all around the world. He has many published researches in journals like JCD and the JCDR. He has invented his own all-purpose burr block that is good for veneer cutting, crown cutting, bridge work, you name it. So he's a pretty impressive dentist, and to be honest, this is one of my favorite interviews, ladies and gentlemen. The way he gave the interview was absolutely amazing. So I would love if you would pay attention and love this interview. Thank you so much. Dr. Carlos de Carvalho, ladies and gentlemen. Hello and good day, Dr. Carlos. How are you? How is the
Hello.
quarantine life going?
Yeah. Just hanging here. Just hanging here.
Really? How's everything in Brazil? I could not
Uh,
stress on it, but still, how's life? How's the lockdown?
yeah, everything is odd. It's
Mhm.
like we are trying to manage, and we are trying to get as much positive vibe as possible.
Mm.
But we have to wait. We are not back to work yet. They
Mhm.
are promising us maybe in 2 weeks or so.
Okay.
Uh, but we have just to wait. We have just to stay at home, trying our best to be productive, trying our best to be ready to come back. Everything is planned, everything is set to receive our
Yes.
patients again.
And it's the most important thing is to stay safe right now because
Yeah,
you can't go back to your patients if you're not alive. So
of course.
you have to stay safe. Okay, so with your permission, should we start the interview?
Yep.
Okay, so let's talk about your journey through dentistry. What made you choose this career path? Like, what was the first thing that you remember that made you choose dentistry as a profession? And just take us through those initial years in your dentistry during your college
Okay.
life. Yeah.
I have a different and a very unique uh, way that I
Hmm.
started dentistry.
Okay.
So at the beginning, I attend to the medical college. I spent 1 year and 8 months,
Oh,
and I
okay.
quit it. And I
Oh,
quit it. I
wow.
was 18 years old, and because my dad, he's a physician,
Okay.
and uh, and he's very smart. He's a genius, and
Okay.
we started to have some arguments, and from my teenager way of thinking, I said, okay, I'm gonna quit, and I'm going to try to do something else just to prove to him that I was good enough to build my own career right from the scratch.
Okay.
And I
Wow.
did that. I did that with 19 years old, and this is something very odd because
Mhm.
and when he starts to pay my tuition, he said to me, "You're never gonna be no one if you are not a medical doctor."
Okay.
And that was really tough. That was
Yeah.
really tough.
Must have
But
been.
right now that I am close to be a dad, I'm 42 years old. My wife is just pregnant, and I can understand his feeling It's like
Hmm.
now I can understand the way that the parents always try to protect, and they
Indeed.
always try to do their best to a sort of prediction what
Hmm.
would be best for you. And I don't blame him at all. Of course, it was rough. It was really something that I was not ready to
Hmm.
see my hero saying that tough words for me. But after years, right now, I can understand him. And after that, I applied for the dental school, and I succeed at the very first spot. I was the highest score, and after
Okay.
that, I didn't have an option. Like, okay, I don't know if it's like I didn't have an option to feel
Hmm.
like, okay, am I gonna like this or not?
Hmm.
I had to. I had to do my
Obviously.
best. I had to make it like a real. I didn't have an option just to quit it again.
Yeah.
So and then I very at the very first stage of my college, I start of the university. I understood that as much effort I put on not only on the technique but also on the relationship with my professors, with my colleagues, with the technicians, with the employees of the university, my life would be easier.
Indeed.
And
Very nice.
I just tried to, and after that, I tried to enjoy the university as much as I can, and I try to make as much treatment as possible.
Hmm.
But above all, I try to treat the patient not as a low cost patient. I try to
Yeah.
treat the patient like, okay, let's pretend I am inside my office. What
Hmm.
would be the protocol? How can I bring the patient from the wait room to the clinic? And and I start to enjoy, and I start to enjoy how the patient was amazed because they
Hmm.
didn't expect that kind of treatment because it
Absolutely.
was I pay less, it was just for free, it was support by the Brazilian government,
Yeah.
and I started to enjoy to understand how to make people feel happy. And
Right. Right.
and this is the key. This is the key
Yeah.
of to be a good dentist.
Good
It's not
dentist. Yes.
just about the technique. It's not
Absolutely.
just about the equipment. It's about to make people feel happy, make people surprising people in a good sense.
Patient satisfaction. That's what we live for,
Yep.
right? Yep.
Yep.
Absolutely.
Period. Nothing else.
Beautiful, beautiful. So, Dr. Carlos, let's talk about a bit about your specialities in dentistry. When did you know that you were more interested in the aesthetic and the restorative and the prosthetic side of dentistry, and not the periodontal or the maxillofacial surgery side? Why did you go for the aesthetic and restorative side?
At the same way that I did every single thing in my life, just by chance.
Oh,
Just by
okay, just by
chance.
chance.
Just by chance. It's like you at the moment that we are living right now is the proof that my philosophy of living it's true. We always we must plan our life for just one reason, to deal with something that is unpredictable. We
Absolutely.
need to plan. We need to keep planning and planning and planning because I can assure you that 99% of the things that you plan is not going to come the same way that you plan it. But
Absolutely.
if you have something that is okay, I have a savings, I have something that can support these unpredictable moments. So I did what I did because of my professors.
Okay.
And right now, I can understand the value of someone coming to you and give you a compliment of something. I was doing a veneer, a resin composite veneer, a
Hmm.
direct one, and one professor he clapped my shoulder and said, "You are good on that. You are really good." I was
Okay.
not, but that kind of compliment make me
Motivation.
feel like,
Yeah.
okay, I can do it. I can
Yeah.
do it. And And this thing completely changed my life.
Absolutely.
Like, and this is how I always respect someone that comes to me, like eager for knowledge,
Absolutely.
wanted an opportunity, and I'm not telling you that I'm always a soft guy. Sometimes I'm really rough. Sometimes someone come to me and say, Carlos, what was your path? I tried to show them that it was not easy.
Mm.
They, we put a lot of effort to show that it's easy, but it's not. It
It's
is
not.
not.
It's
To do
absolutely not.
something in dentistry from the beginning to the end, you must have at least 10 years working daily at the office. At, After 10 years, you can realize why something's happened, how can you solve it, and how long it's gonna last. And it takes time. So I did what I did because of my professors, and after that, I think that the key of a good, uh, a more solid path in dentistry is to try to find good mentors.
Good mentor.
And it's up to you, it's up to your heart to see someone and believe that what he's doing for you is the best, not only for him, but for you too. And I did that. I was looking to my professors, and I always said, I want to be like him. And then I realized one thing, that not everybody is complete regarding very well succeeded in family, financially, in a professional in every single field. So you need to understand that sometimes your professor, he's really good on prepping tooth, but sometimes he's not an example for you regarding how he deals with his family. And at the moment that I start to realize those things and
Okay.
try to extract the best from them, my life completely changed. My life completely
That's
changed.
amazing. That's
Yeah,
amazing. Okay,
yeah.
that's absolutely amazing. That's a beautiful answer. Absolutely. Okay, so let's talk about a bit about your early years as a dentist when you don't really know what you have to do, you don't know where to go, who to
Yep.
go to, how to pursue your passion. So how were those years like, those initial 2 to 5 years when you were a young dentist? How did you cope with those years?
I was so afraid. I was so afraid because uh, I'm talking about the Brazilian dentistry. The average schools, they just give you the idea of the path that you must follow. There are many papers that show to us that we learn 30% of what we need to be a dentist inside the university.
Okay.
The others, the rest of that amount, you will learn step by step. And I was so afraid that from the bottom of my heart, I went to the with my residency, and after that to the PhD, just to have time to learn. And of course, I didn't have money to afford a private office, so that was a sort of a period of standby, learning something from the best of the
Okay.
best in Brazil, and
Oh,
give me time to get mature. So at the moment that I have my preparing myself to own a private office, and took
okay.
me at least 7 years to start to treat real patients, like on
Mm.
pay fee. Took me like 7 years. I was
Wow.
working inside the university in my residency, and after that, I attend to two PhDs, one in Brazil and another one in
Yeah.
Italy. So I quitted the patient's treatment in a reason that because it's different when you treat a patient inside the university and when you treat a patient in your office, because
Yeah. Absolutely.
the
Very true.
responsibility is the same,
Yep.
but it's different when you treat someone that you will meet in a bakery, in your club, in your
There's
building.
pressure. There's pressure. There's
There's a
added
lot of
pressure.
pressure.
Yep.
Yeah, and then that was a wise movement. But I do advise every single one to start your own privacy at very early stages, doing what you are able to do and what you are proud to do.
Yeah.
I mean, uh, easy extractions, resin composite, bleaching, period, and hygiene, period. And
Wow.
after that, go step by step. Always keep in mind that if you do something wrong at
Mm.
the early stage, it will sound so big. It will sound like, my God, I am not capable to do that.
Yeah.
So start from the beginning. Start doing something simple. Try to masterize that step. And after that, is slowly increase the complexity of the treatments. This
Okay.
is by this is the best advice I can do
That's
for
that. Yeah. That's
for a
beautiful
fresh
advice.
student.
Yep.
Yeah,
That's an
but just go
absolutely
step by
beautiful.
step, keeping yourself proud of what you do. Keep yourself like, this is the best class one restoration. No one can do better than me.
Beautiful.
And this is gonna give you a mood that your patient will feel that I can trust him
Yeah.
because he knows what he's doing.
Yeah.
So it's easier to sell. It makes you feel a lot of more confident.
Beautiful. Beautiful. Okay. So you did a PhD in biomaterials.
Yeah,
We know
two
that.
two
You did.
PhDs.
Yep. Two
One,
PhDs.
yeah, I don't
One
know
in.
why, but I did.
No, that's amazing. But
Yeah.
how important do you think that PhD in biomaterials was for you in the pursuit of world-class dentistry? Because you ended up making a whole burr blog, and you obviously know a lot about biomaterials and dental materials. How important do you think this PhD for you was?
It was both things. Like I told you, the PhD make me open my mind in a way that I lived in Italy for almost 3 years,
Mhm.
and I built a huge web of relation, like worldwide. Like I know people all over the world, and because in Siena, that was a university that my professor, my mentor over there, Professor Marco Ferrari, he used to bring the brightest mind in the world to teach us. So, but for a very long time, for a very long time, I couldn't see the worth of it. I
Okay.
couldn't. I couldn't. I was, my God, I have two PhDs, I have a Master of Science, I have a postdoc, and how can I bring that for my daily practicing?
Mhm.
And in the end of the day, how can I make money with that?
Mhm.
Because you can't make money just publishing papers,
Yep.
and to have a lot of papers as I do does not make me any better than a regular
Yep.
clinician.
Okay.
It's a different thing.
Yep.
And right now, after doing, like, I have like 20 years working as a dentist, I can understand that someone who owns a PhD plus who has his own private office, what you can do, you can, based on science, explain your mistakes. This is the point. When you know how to read a
Wow.
paper, when you know the authors, when you know about the statistics, when you know the authors in person, face to
Mm.
face, you are the only one who is able to read a paper
Mm.
critically. The
Wonderful.
only one who
Beautiful.
knows
Mm.
how to read a paper, I mean, to look at the paper and start through the not only the introduction, the
Yeah.
conclusion, through the statistics. You need to understand what is how can you design a stud, because otherwise you are just reading like a comic books. You're just going for
Yeah.
the resume, you are just going for the conclusion, you're just, because you don't know how what is the background of the authors, and takes a lot of time. Like in my
Absolutely.
course, the 3-day course, I code 3,218 papers. I know all of
Wow.
them by heart. I
Wow.
and out of that, 1,000 I know the authors face to face,
Okay.
and I
Wow.
wrote 80. So this not make me a better dentist, but this makes me uh, a guy that I can
Absolutely.
read something, I can try to understand how complex it is, and I can make it simple to teach.
Wonderful. Beautiful, sir.
You understand?
That's amazing.
Does it make sense to you?
Yes, it makes it actually, this is the most perfect way anyone has ever explained research or PhD research to me, because it's absolutely amazing the way you're telling that, you can explain your mistakes with research, and you can
Yeah.
talk statistically, and I get it. Like, it's very important, and hats off to you.
And I like titles does not make anyone better.
Yep,
Does not give me the if I'm a good human being, if I
absolutely.
if I do something right. But there is a sort of a filter that it's like a sort of a filter that okay, you succeed this exam, the other one, the
Yep,
other one.
yep.
You expose yourself in front of. Last year, I present in front of close to 3,000 people. It's like
Wow.
like you expose yourself so much that in the end of the day, you have automatically filter that okay, we can trust him, we can
Yeah,
rely on that guy.
absolutely.
It's like when you succeed not only in the clinic but also in front of a large venue like a
Absolutely.
authorities in addition in pros in it's like makes you a more reliable source of knowledge, period.
Absolutely.
But
Absolutely.
it's like I hope it makes sense to you.
No, no,
I
it
hope it
does.
makes sense.
It makes perfect 100%. Absolutely. That was a beautiful answer. Now let's move on to your social media following. You have your Instagram famous. You have around 100,000 followers on Instagram, and your cases are amazing. We all know that. But if you had to choose one good thing and one bad thing about being an Instagram famous dentist, what would those be?
So, I was a little bit astonished when I arrived in a congress last year. And the highlight of my resume was my Instagram followers, the number of my Instagram followers.
Oh
And I
yeah.
said, okay, so my PhD, my Master of Science, my doesn't count. And right now, this year, I think that the followers, if I may say, they start to realize that the number of the likes, the number of the photo doesn't mean nothing. It's like you need to follow someone in a sense that he adds something to me in a in a in a good way. Okay,
Okay.
we know that is always going to be a crowd for just Bieber, and but I like James Taylor. It's
Yeah,
like there is nothing wrong. Don't get me wrong. There is
yeah, yeah.
nothing wrong if you give your likes, if you give your attention to someone that I do not agree 100%.
Okay.
But I understand right now that I start in Instagram in 2011. I was
Okay.
the original dentist over there, and right now I can understand that people are more conscious about Instagram. Now they know that the numbers doesn't count, and
Okay.
this is the bad thing I think,
Yeah.
and the good thing is like it completely changed my life. It completely
Okay.
changed my life. I could show to the world my work.
Mm-hmm.
Like you call me like instant famous, but I'm just a regular guy. I was lucky enough to be at the right moment, at the right side,
Mm.
knowing a lot of dental photography, and everybody was on Facebook, and I started to use Instagram.
Okay.
Why? Because I have like so much free time that I didn't have nothing to do, and period, nothing else. It's like
Okay.
and but to to like social media, the final goal is to put in contact with people, and
Absolutely.
with time it's getting like a wine, better and better.
Yeah.
My Instagram does not grow so much as it was used to grow, and I don't care because I don't need more than like a 1,204
Yep.
people with me. This is more than enough, but it's getting more solid, It's like it's
Yep.
getting more solid. This is why stories for me are way more important than my regular feed. It's
Yep.
like because in stories I can reach like 5,000 people, and they are the one that really are attached to me. They are really engaged to what I think it's what I want to share.
Okay. So building on the same question, in a modern day world, in modern day dentistry, how important do you think dental photography is, and how important is the use of social media in dentistry? You've already answered the latter part, but how important is dental photography?
Okay, so we have English, Spanish, Italian, Portuguese, and we have Instagram. Instagram is a language that
Okay.
you must know how to talk, you must know how to pay respect, you must know how to interact, and to get the advantage of that, you must masterize it on dental photography
Yeah.
because it's a way to attract people. Period. And after you have because right now the most valuable thing is your attention. I need to attract you in 1 second when you are scrolling, and so you can feel okay. Let me read the subtitles, and
Okay.
this is the most important thing right now.
Absolutely.
And dental photography, in this sense, has a very important role. Besides that, doing what I do without dental photography, it's like
It's
there's no
it
way.
yeah, it doesn't
There's no
make
way.
sense. Yep.
It's like for me to prep without a contra angle. There is no way. There
Oh,
is no way
oh,
to think like, okay, can I do what I do without a milling machine? Yes, I can. Can I do what I do without a scanner? Yes, I can. Can I do
oh.
what I do without dental photography? No, I can't. I can't
Okay.
because I
Wow.
have to send pictures for my technician. I have to show, I have to impress and to show my patient what will be the final result. And I
Okay.
must masterize in that photography. And when I started 24 years ago, it was so hard because we were the ones who developed dental photography in
Yep.
the level that we are
Yep.
right now. And
Absolutely.
uh, and we spent so much money, and I bought so many things, and right now it's like a piece of cake. It's like right
Yep.
now it's easy to do. For us it was not as much complicated as the older generation
Yep.
because they used regular films, and I started with digital, but it was so good, my friend. It was so
Yep.
good
I'm
because
sure.
every single shot, like trying to find the right camera with the lens, with the
Absolutely.
lights. And
Absolutely.
right now it's a very straightforward protocol. There is
Yep.
nothing much to advance. There's nothing much to improve. I don't see any improvement in the future with dental photography. I don't see nothing else. We are there, and that's it. But it's mandatory. In
Yep.
my field, it's
Absolutely.
mandatory to masterize in dental photography.
Okay. That's perfect. Okay. Moving on to our next question, and I'm sure you've gotten this question a lot in the past few months. The coronavirus and how this virus has come suddenly, become a pandemic, and affected almost every profession out there. But it
Yeah,
has probably affected our profession. Our profession is one of the most affected professions by this COVID-19. First question is, how are you guys dealing with it in Brazil? What do you guys plan on doing, and what do you think the future of dentistry is in a post COVID-19 era?
what I think is like we will have to adapt until a vaccine is there, until we have the solution.
Mhm.
But I'm talking about the Brazilian dentistry. We added just a few things in the way that we used to do,
Mhm.
in the way that I used to deal with 2 3 patients per day, the most. I
Okay.
used to use all the face shield and a very good mask. I used to do that. The only thing that I was not so much paying so much attention, it was not okay. So let's remove this book from my operatory. Let's remove this. Let's clean a little bit more. But besides that, I don't see a huge change inside what I do. Of
Okay.
course, there are another ways. Like I have so many colleagues that they used to treat like a 15, 20 patients per day,
Okay.
like especially in ortho. They use, and
Mm-hmm.
now for them they will be way more affected until a final solution comes. It's like
Mm-hmm.
until there. Maybe it's next month, maybe in 6 months. But I think that the patients will give way more value for us, the guys who are
Absolutely.
doing something great in the right way, doing something like by the book.
By the
Because
book.
it's like, because it was like, okay, I use face shield, they look to me like, why you are using this? For your protection, for my protection. Now, every single human being on earth know that that thing, it's good for him and good for us as well. It's like a protection
Absolutely.
thing. So the ones who have been doing this protocol for years now will be way more recognized as a good dentist, if you will. And but one other thing that is going to completely change is like people, our generation will never be affected by something that with that size. What I think is like, especially in Brazil, we will our mind will change in regard financial. We will
Okay.
think, I need to have a little bit more saving. I need to
Yeah.
have a little bit more. It's like it's thing, because who knows if next year something else will come again.
Yeah.
It's like, so
Absolutely.
this is the way that we need to change. It's like
Yeah.
it's not only on inside our office but also in our life,
Our
because
business our business models need to change as well regarding our private practices.
yeah, of course, of course.
Absolutely.
And this is what I think is like, in Brazil we just add like, okay, face shield for me, for my assistants, alcohol in gel. We used to use that, and nothing else, because
Yeah.
it was something that was, for us, it was completely regular. It's like, oh, one thing, I used to use one coat, like it was like a handmade coat, like I used to
Yeah.
use two per day, and
Okay.
now I'm using a disposable one.
Okay.
That changed it. That changed it. I used to
Okay.
use two per day. It was like a cloth, like a
Yeah. Yeah.
regular one. It was not disposable. And right now I use like all my clothes, my pants and my shirt is disposable. And
Okay.
and and that's changed. That changed. But besides this, that
Okay.
nothing else. Nothing
That's
else.
perfect. That's
Nothing
perfect.
else.
Okay. So let's talk about a bit about our countries, because Brazil and Pakistan, they're a bit similar in terms of the population.
Yep.
So there's Brazil has a huge population, and same here. Pakistan
Hmm.
has a huge population over here as well. Now, do you think, in your opinion, is dentistry overpriced? Because of dentistry being overpriced, not everyone gets dental care the way they should. And do you think is that a thing that hampers people from getting their dental treatment done?
It's a very complex answer, because
Yep.
uh, in reality, uh, the Brazilian dentistry is the best in the world, for sure.
Okay.
I have been traveling all over the world, and yes, we have the best dentistry, not only because of the dentist, but because of the high demand of aesthetics, like US. We have a
Hmm.
very good influence of minimal invasive dentistry from
Okay.
Europe, and we have lots of good technicians.
Okay.
So we have not, it's not just the our hand skills. It's like
Okay.
it's the conjoin of that four topics, and since we are a lot, we are close to 200,000 dentists in Brazil.
Oh
The
wow. Okay.
bar is really high.
Okay.
So if you want to find a place under the sun, you need to be very good. You need
Okay.
to be very good. And but unfortunately, I can maybe say that 3% of the whole population have access to that kind of dentistry. Why? Because it's expensive. It's not expensive because I want to be. It's
Yep.
expensive because it is.
Yep.
It is because
Absolutely.
uh, I used to say to my students in US that every single thing that you pay here, I will pay 6 times more. You understand this? So
Yep.
if this laser costs you 300 30K, from me it will cost 6 times more, or it will be 6 times more difficult for me to buy it
Okay.
because the
Yep.
taxes are really high. To find a loan to pay, it's extremely difficult. To find
Absolutely.
patients for pay, it was like, and this, of course, reflect on the price that the patient has to pay. But in Brazil, we have a lot of good university that they can do that level of dentistry almost for free, if it's not totally for free.
Yep.
So the population in Brazil, in a sort of, they can access that kind of ideal dentistry, but
Okay.
definitely not the whole population. And
Absolutely.
unfortunately, I would love to do. I did so many clinical trials in poor
Mm-hmm.
communities when I was doing my PhD, and that made me so happy because when you bring that level of dentistry for them,
Yep. Yep.
they were not used to, and like just a simple rubber dam for them, it was what is that? What is that thing? And
Yeah.
but to see their eyes shining and makes you feel like a good human being. But
Yep.
you are
It
right.
it
You
does.
are right. In Brazil, I can extrapolate like 3-4% of the whole population has access to that high quality dentistry. And this is not due to us, it's not due to the price, because every single thing is extremely expensive.
Yep.
If you
It
want
makes
to keep,
sense. Obviously.
yeah, it's like it's like there is no way out. There is no
Yep.
way out.
That makes sense. Okay,
Yeah.
so Dr. Carlos will be moving towards the end of our interview now. So I just want to ask you any advice, or what do you think about this startup of ours for the dental community of Pakistan, and any advice that you would like to give us on your behalf?
Oh, that's so many. It's like uh, how can I say? Uh, Try to do something that makes you proud of yourself.
Oh,
You know?
wow, that's perfectly
Yeah.
put. Thank you so much.
Period. Because
Yep.
sometimes you're not gonna get the recognition of the patient. It's just
Mm-hmm.
gonna be like the money,
Yeah.
and you see that when you have it, it does not make any value at all.
Yep.
It will become like a watch, or it will become like a travel, a car. But when you feel proud of yourself, when you feel proud of what you do with your hands, what you do with your brain, your heart, it makes you feel like it's
Wow.
worth living. It's like
Yep.
and
Absolutely.
and and period. Because at the end of the day, the most important thing is when you look at the mirror and say, "I'm proud of that guy. I'm proud with every single thing that he has been working for." It's like, and that's it. Because to do a
Beautiful.
good resin in 10 years, of course, you will do. To do a good preparation, of course, but it's commodity. It's something that, okay, what
Yep.
else? What else? And
Beautiful.
and the what else? The wells is to treat people as with the right value, and
Mm-hmm.
to be proud of yourself. And I think this is the the good advice that I strive my whole life to be proud of myself. I'm not there yet. Actually, I'm really far, but I just try to spread that word. Like, do something that try to strive. This is a quote from Manuel Fangio, the driver,
Okay.
the racer. He said, "I strive always to be the best, but never believe that you are." And
Okay. Wow.
yeah, because
Beautiful.
it's like I know so many guys that are way better than me, that always keep my feet on the ground, and this is
Absolutely.
good. This
Yeah.
is good when you have very good friends, and I do have, and this keep me always my feet on the ground because there always gonna be someone better than you in one thing. You know that sometimes the guy is not so good in preparation, but he knows how to deal with humans. He know how to bring
Yeah,
the patient to the
yeah,
office. And sometimes you see someone that he knows really good about the technique. He has the skills,
yeah,
but he can
yeah,
speak. He can convince the patient.
yeah,
And to convince, it's not to uh, mistreat the patient. To
yeah, yeah,
convince is like to show to the patient in words with your eyes that the thing that I'm doing in your
yeah,
mouth, it's the best thing, and no one can do better than me.
yeah,
Because if
yeah,
you believe in that, and if you masterize on that field, it's easier to convince.
absolutely,
Your employees will fight for you by your side because they can see the passion in your eyes,
absolutely.
and the patient, he's there. He's like, okay, here it's you have my trust, you have my money, and
Yeah,
do your job,
yeah,
and
yeah,
that's
yeah.
it.
So our last question, and this is a question from me and my team. If you ever get an opportunity, would you be willing to come to Pakistan for the course that you conduct, the adhesive rehabilitation and tooth preparation? Would you ever be willing if you ever get a
my pa-
chance?
my passport is right there. Just book the ticket and I'm going. And I'm going.
Oh, that's
It will be my
perfect.
pleasure, really. It will be my pleasure. This is what
That's
this is part of my life. This
yeah,
is and this is the kind of invitation that makes me feel alive. You know, it's like
yeah,
when I can through the internet, through the Instagram, I can send to you the trust, the reliability, and every time that I get this sort of invitations, like makes me feel like proud of myself. Can you see
yeah,
that? So
yeah,
it's like
yeah,
now there is someone that is on the other side of the world trying to get close to me. Of course, this is a gift and a course. This is a gift because it makes me happy, but it's a course because you are willing to bring me to your country,
absolutely, sir.
put your reputation on the table, and this always makes me like going more and more. If I open my iPad for you, I was reading papers and papers, trying to getting better and better to never let people down. And
Mm-hmm.
this is something that I forgot to mention. Instagram sometimes put people in a so high stage that it's easy to let people down.
Yeah,
And
yeah,
this is something that we need, the ones that gain people trust. We need to strive to always give people something else. It's like,
absolutely,
and many times it's not just about like knowledge. Sometimes it's just
absolutely.
a hug. Sometimes it's just a good vibe, a good word, and uh, and that's it, my friend. And
That's
in,
beautiful.
in my last and final word, every single thing that we do and that we work in dentistry, it's all about the patients. We need to provide for them the best of the best, and uh, and that's it. And that's it.
Thank you so much, Dr. Carlos.
You're more than welcome.
It has been an absolute honor. Thank you so much for taking time out for us. It meant a lot to me. It meant a lot to my team. And honestly, I got to learn a lot from these 30 odd minutes that I've spent with you. It has honestly been an honor. Thank you so
Okay.
much.
Thank you. Thank you.
Thank you so much. Take care, sir. Stay safe.
Bye bye.
Bye.